The Cayman Islands Health Services Authority's general practice and public health clinics have relocated to Smith Road Medical Center. At the new location, you'll receive top quality care in a comfortable, modern space, enhancing your patient experience. Do you have flu-like symptoms or other non-emergent illnesses or injury? HSA's new urgent care walk-in clinic is now open at the main hospital campus. The new general practice location is for appointments only. For more information, call 949-8600 or visit hsa.ky.
When you have a sports or fitness-related injury, trust the expertise of the HSA Sports and Exercise Medicine Clinic to get you back in the game. Our internationally trained and certified physicians specialize in sports traumatology, sports medicine, pain management, and orthopedic surgery. For treatment of common injuries such as tendonitis, arthritis, tennis elbow, rotator cuff, or knee tears, schedule a consultation with the Sports and Exercise Medicine Clinic at Smith Road Medical Center by calling 949-8600 or visit hsa.ky for more information.
Health Services Authority is now offering online payment options for patients. Patients of HSA can now pay their bills, including deposits, towards scheduled services online at payments.hsa.ky. The secure, new online payment system accepts debit or credit cards and is in addition to the available payment options of cash, check, and online bank transfer. For quick, easy, and secure payment directly from your phone or computer, visit HSA's new online payment system at payments.hsa.ky.
The Health Services Authority's new pharmacy is now open at the Smith Road Medical Center. The new location features a large, comfortable waiting area and ticketing system to improve the patient experience. All uncollected prescriptions and refill requests previously submitted will now be available for collection at the Smith Road Pharmacy. Request your refills online at hsa.ky via WhatsApp 925-6534 or call 244-2715. For more information about our pharmacy hours, visit hsa.ky.
At the Health Services Authority, we want to keep you informed about the latest developments that impact your health because your health matters to us. Join us each Friday and Saturday from 1 to 2 p.m. as we cover health news, offer advice, and answer your questions on Healthcare Today with HSA.
Welcome to another episode of Healthcare Today with the HSA. I'm your host, Chuck Taylor. Thank you so much for tuning in each and every Friday. And we rebroadcast on Saturday. We get together and we talk about all things related to your health. And you know what? This is kind of a throwback to, we just got through with Movember, and we talked about all the things with men's health issues. And I want to kind of bring that up because this is the season, and a lot of men are up and down. They're working, they're doing all this. They really don't take care of their health. And this is something that I really want to bring to the forefront. I have with me today two guests. If you could just go ahead and introduce yourselves.
Amanda Nicholson. I'm the Cancer Registrar for the Health Services Authority.
I'm Dr. Jyoti, Shravana Jyoti, Consultant Pathologist with the Health Services Authority.
Excellent. And one of the things, let me start with you, Dr. Jyoti. Give me a little bit about your background and your specialty with prostate cancer and things of that nature.
I work as a pathologist. Pathologist is the one who study and diagnose infectious diseases and cancers. So, since I diagnose cancers, prostate cancer is one of those frequent cancers I regularly deal with here in Cayman Islands. And also, I do autopsies. Also, sometimes we do get prostate cancers which were undiagnosed during autopsies.
Okay.
Yeah.
Okay. And I know this is kind of a vague question, and Amanda can chime in also here. How big is prostate cancer here in Cayman?
In Cayman Islands and in Caribbean and throughout the world, prostate cancer is a major issue regarding cancers. Along with the colon cancer, we call colorectal cancer. It is one of the main cancers that is affecting men, and also it is one of the main reasons for cancer-related death, or we call mortality, in the U.S., in Caribbean, and Afro-Caribbean ancestry and Afro-European ancestry people.
So I want to bring Miss Amanda into this because now we can talk a little bit about numbers as it relates to our region specifically. Huge numbers, medium numbers, as relative as can be.
Well, of all the men who have registered with us, about 18% said they had prostate cancer. So it's about what you'd expect. It's the most reported cancer to the registry for men. As Dr. Jyoti said, it's worldwide. It's one of the more common ones.
Okay. And also, just as a reminder, the information that you receive is voluntary.
Yes. We don't pull information from medical records or pathology reports, which is how registries typically operate. We rely on volunteers to come to us and give us their information. So while the registry gives us a nice snapshot into statistics in Cayman, we're not capturing every case. Not at all.
Not at all. Okay.
Yeah.
And do you find, okay, if I'm been diagnosed with cancer, prostate cancer, and I wanted to be a part of the registry, how walk me through the process to do that?
We try to make it as easy and as quick as we can for registrants. There are several different ways someone can register. They can register at the Cancer Society. They can come to my office at the Georgetown Hospital. It can even be done online. We have forms available at the Health Services Authority's website, the Cancer Society's website, and the Breast Cancer Foundation's website. And registering is fast. It takes maybe 5 minutes. The questions that we ask are things you'd know off the top of your head. So we're not asking you to go get a whole medical file or anything like that.
Right.
So quick and easy.
Quick and easy, exactly. And that's great because a lot of times, when it comes to getting numbers and giving information, people are a little bit hesitant. They're a little nervous. They're like, well, what is it for? Where does it go?
Absolutely.
Walk me through what your numbers have the ability to do.
Well, it gives us a foundation of information about what cancer trends look like here. We can see how many people get cancer each year, what types are most common. We even ask registrants whether or not they were able to receive their first treatment on island or if they had to go overseas for it. So cancer registries, not just ours, but cancer registries in general, have the potential to give us really solid numbers so that we can use that to develop prevention programs, cancer management strategies, so we know what we need at the hospital in order to best serve our cancer patients.
Okay, and let me switch that to you, Dr. Jyoti. Based on published research and information of that way, how much is knowing about the community in your field?
I would like to give a little bit more introduction about prostate-specific antigen and about prostate cancer before talking to the incidents and our research here in Cayman.
Okay.
Prostate cancer usually occurs in the periphery of the prostate. If the gland is polygonal, it happens in periphery, starts in periphery, and by the time it is detected with the urinary symptoms and hematuria, it is too late. It has gone to the advanced stages. So during early stages, prostate-specific antigen is the simplest and easiest tool for us to detect early diagnosis of cancer by going through the values of PSA. The PSA values are usually around 4 nanograms. It's a normal cutoff. And this cutoff value will be raised during prostate cancers. And also this value is raised not only in prostate cancer but also in benign enlargement of the prostate, instrumentation, lot of inflammation or infections of the prostate, or sometimes when prostate goes for infarct. In all these cases, prostate-specific antigen is raised. So it means that PSA has a very good sensitivity. It means we can detect PSA as soon as it is elevated. But when PSA is elevated, we cannot surely say that it is due to prostate cancer.
Okay.
See, if, for example, if PSA is 20 nanogram, it doesn't mean that the individual has a prostate cancer. So he may be having a benign enlargement of the prostate, which is age-related, also inflammation. So it's a very complex area because PSA has a high sensitivity and a low specificity. So it's a complex area throughout the world, but it has to be detected early according to some studies. So we conducted a study in 2018. It was published in Cancer Causes and Control, the article is available on PubMed also. The name of the article is Prostate Cancer Screening by Prostate-Specific Antigen, a relevant approach to the small population of the Cayman Islands. So if you type Cayman Islands and prostate cancer, this is one of the articles that appears.
Okay.
And it has been widely accepted, and it has been cited by at least 20 other papers.
Okay.
Because PSA detection is a complex. PSA detection and PSA relating PSA to cancer is a very complex process.
For someone who's tuning in and you say PSA, what exactly is that? I know what it is, but break it down and tell them what that consists of.
Yes.
From a non-medical term, what that means.
So PSA is a secretion, proteinaceous secretion that is secreted by prostate gland. So basically, majority of it is secreted into semen, where it is used to break the coagulum of semen, but small quantity and specific quantity is secreted into the bloodstream also. Very minute quantity, maybe 0.1 nanogram to 4 nanogram, which is very normal. But this PSA that is secreted into the bloodstream may be high in case of various conditions, including prostate cancer.
Okay. So it's really a starting point to do another level of check into what you're looking for, because when you think of that, as you said, it could be benign with something else, but you really need to start focusing, say there is an issue here, there's a problem here that we need to take a look further at to get some more information. I think that would be a good time for us to take our first break. If you're just tuning in, it's Healthcare Today with the HSA, talking with pathologist Dr. Jyoti, and also our Cancer Registrar, Amanda Nicholson. We're going to take a quick 2 minutes and be right back.
When you have a sports or fitness-related injury, trust the expertise of the HSA Sports and Exercise Medicine Clinic to get you back in the game. Our internationally trained and certified physicians specialize in sports traumatology, sports medicine, pain management, and orthopedic surgery. For treatment of common injuries such as tendonitis, arthritis, tennis elbow, rotator cuff, or knee tears, schedule a consultation with the Sports and Exercise Medicine Clinic at Smith Road Medical Center by calling 949-8600 or visit hsa.ky for more information.
The Health Services Authority's new pharmacy is now open at the Smith Road Medical Center. The new location features a large, comfortable waiting area and ticketing system to improve the patient experience. All uncollected prescriptions and refill requests previously submitted will now be available for collection at the Smith Road Pharmacy. Request your refills online at hsa.ky via WhatsApp 925-6534 or call 244-2715. For more information about our pharmacy hours, visit hsa.ky.
The Cayman Islands Health Services Authority's general practice and public health clinics have relocated to Smith Road Medical Center. At the new location, you'll receive top quality care in a comfortable, modern space, enhancing your patient experience. Do you have flu-like symptoms or other non-emergent illnesses or injury? HSA's new urgent care walk-in clinic is now open at the main hospital campus. The new general practice location is for appointments only. For more information, call 949-8600 or visit hsa.ky.
HSA's cardiology clinic is now located at Smith Road Medical Center. Our cardiology team provides expert care and treatment for heart conditions such as coronary artery disease, heart failure, arrhythmias, hypertension, congenital heart diseases, among others. The new location offers state-of-the-art cardiac diagnostic testing, including echocardiograms, ECGs, and stress tests. To contact, call 949-8600. At HSA, your heart matters to us.
At the Health Services Authority, we want to keep you informed about the latest developments that impact your health, because your health matters to us. Join us each Friday and Saturday from 1 to 2 p.m. as we cover health news, offer advice, and answer your questions on Healthcare Today with HSA.
Thank you so much for tuning in to our Healthcare Today with the HSA. Each and every Friday and Saturday, we get together at 1 p.m. and we talk about all things related to your health. Of course, we're just coming out of Movember and bringing awareness to a lot of campaigns that they've had. I want to say that, the last 20 years, we've seen a lot of information come out about men's health. And I say kudos to all the people who have been involved in helping that information get to the public, because for a long time there was, I say, being as old as I am, I don't remember growing up watching any shows or talking about men's health. That, it was like, okay, if you were sick, you just went to the doctor and that was it. And that may have been once every 4 or 5 years, which we know as you get older, and the doc can help me with this, as you get older, you need to check and know what your baseline is a lot earlier than every 5 years. Tell me a little bit about that, about prostate cancer, colon cancer, and age, doctor. Give me a little information about that.
When you talk about men's health, it's very important for us to choose what we are going to do once we are 50 plus years. So in this age, there are important factors like diet, exercise. Also, we have to be very cautious about our health. So in that, we have to go for a stool test, simple test to detect colon cancer, which is again high in this region, and also prostate specific antigen or PSA levels to detect prostate cancer. PSA is again, as I told you, it's a reliable, it's a complex, but it can be raised due to many diseases. The study that we did in 2018 suggested that if the PSA level is below 4, we can be relieved, that we can link that the person has no prostate cancer, no further tests are needed. If it is more than 4, yearly observation of PSA levels have to be undertaken to find that whether the person has a prostate cancer or not. So, and here we have, that is one of the studies, and in 2012 our Cancer Registry was established, and important movements like Movember and PACE Foundation, they encouraged talks, discussions, and also as a part of these movements there was a free PSA testing. So also recently we thought of doing one more study as to see whether these movements have any impact in prostate cancer related activities and PSA testing in our island. And also during this time, along with these movements, there were more number of urologists available to the population here, and radiological tests like MRI of prostate was developed, and also they started taking many biopsies from the prostate to find out incidence of prostate cancer. So we found that these movements really have helped in bringing out prostate cancer cases. So after these movements, number of biopsies were increased. Age at diagnosis is reduced. It means that people are more aware about their diagnosis, and PSA level is again reduced. So these are the various benefits that we got from these movements.
And I want to switch gears a little bit and talk to Miss Amanda. But based on that, so because of these, I want to say awareness moments, as the doctor was saying, that the numbers have come forward. They've been there, but we just didn't know it and it wasn't recorded. Would you say that would be a kind of a correct ad?
I think so, yes. And every time that we have these awareness campaigns, whether it's Men's Health Awareness Month or Breast Cancer Awareness Month, every time we see registration rates go up. And over the years, they've continually climbed. And I think it is in part because of these events. And I think it's also helped to make talking about cancer a little less taboo. So it's useful for Dr. Jyoti's research, and it's useful for me because I get more people who are willing to register, which just increases our information. So, yeah.
And I think kind of the campaign for understanding has been better. Before, when people talked about cancer, it was almost as if you were talking about a death sentence automatically. It was like, oh, well, and folks, you bear with me, I'm just going to signed a name and that's going to be it. I'm just going to wait the time. When there have been treatments, there have been lifestyle changes to help extend and put into remission quite a bit of this early detection, as the doctor said, is the key.
Absolutely. And I think another thing that's helpful is I'm seeing more and more cancer survivors who are recovered and in remission sharing that it's not a death sentence. There are so many more treatments available today than there were years ago. But early detection is the key factor, so you need to get your screenings,
Exactly. And I would say, Doc, based off of this, the PSA testing has changed in the last 20 years also. Would you say that it's a lot more acceptable now?
Yeah. Basically, what I would say is we have now this men's health campaigns, also a lot of urologists available, as well as we have Cancer Registry. Just to give you an example, I have come across one individual who is more than 50 years where when he tested his PSA level, it was 2.3, some like that. And because he had a strong family history, we had advised him to get tested every 2 years. Then when we followed up, it went up to 6, it went up to 10, like that. So he was, when it reached 10, up to 10, we did the biopsy. He got the biopsy done, and prostate cancer was detected at stage T2. It is a stage where prostate cancer is still confined within the gland. So in contrast, before these campaigns were done, maybe in 2009, 10, like that, I encountered a patient whose PSA was a staggering level of 3,000 when he got tested for the first time, because there were no awareness campaigns.
No awareness
so already he was in an advanced stage. That is where life can be saved.
Right, exactly, because as we said, early detection is the key. Imagine at 2, we're talking detection, and you're finding it at 3,000 before we started these awareness campaign. That's not only is that frightening, but that's life that we're talking about there. It boils down to the difference between today and tomorrow in some cases. It's really, if there's anything, people, if you're listening to us and you have a male in your family, Doc, what would you say would be the ideal age to start testing? Because I've heard 45, I've heard 50. What would be, from a doctor standpoint, just a ballpark figure to start thinking about, hey, maybe you should get this testing for all the people out there who's listening?
Again, I'll have to go into more details on this. As you all know, prostate cancer prevalence or the incidence is very high among African ancestry people. So we have to be aware that there is a high chance of prostate cancer being diagnosed more than 40 years of age in people who have African ancestry, and also who have their first degree relatives suffer from prostate cancer. So in those people who have a high risk factors, so American Urologic Association early detection of screening for prostate cancer advises that those people should start screening at age of 40 years.
40 years.
So if the prostate PSA is within normal limits, then they can repeat at 45 years, then 50 years. So every 5 years. If they and also we have to encourage them to get tested at least once in 2 years or 3 years, depending upon the circumstances and the family, according to the risk factors. So if PSA level is increasing, then prostate biopsy is advised. Otherwise, if people have no strong risk factors, 50 to 69 years, prostate PSA should be tested. Starting from 50 years, if it is if the PSA is within 4, then we can have 3 or 4 years interval. If PSA is more, then we can have every 2 or 3 years interval testing.
So knowing your background history and where your I want to say cultural identity lies has a great influence on the probability of developing something. So you really need to start checking, as you said, folks, with the Caribbean descent, with African heritage, from about 40 years of age is a good starting point to at least have a baseline to say, okay, we've started here and let's watch it over the course of the next few years.
Yeah. At least get checked at 40 years. If it is within normal limits, get tested every 5 years. And if people have a strong family history, get it tested every 2 years.
Okay.
Otherwise, if people have no family history, start testing at 50 or 55 years, then get tested every 2 years.
Okay.
Up to 69 years. PSA screening is very useful between 55 to 69 years, according to the research studies.
Okay.
Yes.
All right. We're going to take a quick break and come right back. We're talking about prostate cancer and also the existence of the Cancer Registry and the good that it does here as far as information. And we'll talk about a little bit about policy making when we come back, as it relates to healthcare and the general idea of it. Keep it right here. This is Healthcare Today with the HSA. I'm your host, Chuck Taylor. We'll be back in 2 minutes.
Health Services Authority is now offering online payment options for patients. Patients of HSA can now pay their bills, including deposits, towards scheduled services online at payments.hsa.ky. The secure, new online payment system accepts debit or credit cards and is in addition to the available payment options of cash, check, and online bank transfer. For quick, easy, and secure payment directly from your phone or computer, visit HSA's new online payment system at payments.hsa.ky.
When you have a sports or fitness-related injury, trust the expertise of the HSA Sports and Exercise Medicine Clinic to get you back in the game. Our internationally trained and certified physicians specialize in sports traumatology, sports medicine, pain management, and orthopedic surgery. For treatment of common injuries such as tendonitis, arthritis, tennis elbow, rotator cuff, or knee tears, schedule a consultation with the Sports and Exercise Medicine Clinic at Smith Road Medical Center by calling 949-8600 or visit hsa.ky for more information.
The Health Services Authority's new pharmacy is now open at the Smith Road Medical Center. The new location features a large, comfortable waiting area and ticketing system to improve the patient experience. All uncollected prescriptions and refill requests previously submitted will now be available for collection at the Smith Road Pharmacy. Request your refills online at hsa.ky via WhatsApp 925-6534 or call 244-2715. For more information about our pharmacy hours, visit hsa.ky.
The Cayman Islands Health Services Authority's general practice and public health clinics have relocated to Smith Road Medical Center. At the new location, you'll receive top quality care in a comfortable, modern space, enhancing your patient experience. Do you have flu-like symptoms or other non-emergent illnesses or injury? HSA's new urgent care walk-in clinic is now open at the main hospital campus. The new general practice location is for appointments only. For more information, call 949-8600 or visit hsa.ky.
HSA's cardiology clinic is now located at Smith Road Medical Center. Our cardiology team provides expert care and treatment for heart conditions such as coronary artery disease, heart failure, arrhythmias, hypertension, congenital heart diseases, among others. The new location offers state-of-the-art cardiac diagnostic testing, including echocardiograms, ECGs, and stress tests. To contact, call 949-8600. At HSA, your heart matters to us.
Now back to Healthcare Today with HSA and our host, Chuck Taylor.
Welcome back to Healthcare Today with HSA. My name is Chuck Taylor. Thank you so much for tuning in right here each and every Friday and Saturday. We get together and we talk about all things related to your health and your wellness and also information. A lot of times we talk about things that you may think, oh, you know what, it's not related to me, but someone in your circle may be going through this or having to experience this. This is information to help guide you and also help them going through whatever health challenges they have. And speaking of that, Miss Amanda, Amanda from the Cayman Cancer Registry right here. When we talk about that, if someone has cancer and they haven't registered, how can I have that conversation with them to talk about what it does and what it means to be registered?
First, I would let them know that the information is confidential, and I'd let them know where the information is going. it isn't shared with anyone outside the registry, not insurance companies, not anyone. So it's confidential. And I would also explain that this is how we figure out what cancer trends look like in Cayman, because we're not like every other country. We've got a very diverse population, and we need information on what cancer looks like here. I think it's all about letting people know that this is a benefit. You know, it's not as though we're just keeping track of people who have cancer. You know, we need to know how many people are getting cancer, what types of cancer. And it's also important to mention, I think, going back to confidentiality, that we don't put their name in the database. They're randomly assigned a code number.
Okay.
And I'd also emphasize that it's a really easy process. You know, like I said, if you've got a printer, you can print off a form, scan it, send it off. You don't even have to leave your house.
Okay, it's that easy, that simple.
It's that easy. And some people prefer to have a conversation with me before they decide if they want to register. And that's always an option too. I encourage people who aren't really sure if they want to register to just give me a call and we can talk about it first.
It makes it more personable when you, because a lot of times, you know, people over the years have been, you say, oh, you know, well, my data's out there in the world and things like that. They have a real understanding about that. But you, as you said, it's all a numerical number. There's no names. There's no correlation to a specific person.
No. You can, the only one who can access the registry is me. But if somehow, some way, someone did access it, almost all the data is coded. There's no name, and you know, even when we ask what district they live in, that's coded. It doesn't say West Bay; it says something else.
Okay,
yeah.
Excellent. So there's a lot of anonymity there because you really want just the information.
Yes. I mean, what their name is or where they work or any, you know, things like that don't matter. We just need to know basics about their cancer diagnosis and a little bit of demographic information.
Exactly. Okay. Well, let's switch it over to you, Doc. Doing what you've been doing for so many years, talk to me a little bit about the scope of cancer as far as prostate goes with that.
As I told you earlier, PSA has a low specificity. It means once it is raised, it doesn't only mean that person has prostate cancer. It may be due to other reasons also. First, the prostate biopsy has to be done to eliminate the possibility of cancer. So prostate again, sometimes we tend to diagnose prostate cancer which is organ confined, which is less than 5% of prostate. And it may be confined to prostate in what we call as indolent nodules or resting nodules, in which case prostate cancer will not progress to the next level for decades to come. So when we are robust and when in doing screening, these cancers will be detected and people will get phobia and stressed out because they have a cancer.
Right.
So some of these cancers, they don't really need aggressive treatment. So that is the side effect of these aggressive testing. But we have to be balanced in weighing the advantages and disadvantages.
That's what I wanted to talk about, the challenges and possibly the opportunities in managing and probably enhancing a better outcome. Talk to me about that. Because as we said earlier, you know, at this day and age, medicine has been leaps and bounds and also human understanding of taking care of yourself so that you can maintain a better lifestyle. Talk to me a little bit about that.
So, as I told, men's health above 50 is a challenging. We need a holistic approach in diet advice, education, as well as psychological counseling, as well as various tests, including PSA. And in people who have been detected of prostate cancer, we have to evaluate whether it is only 5% or more than that. Then accordingly we have to plan our strategies. And also what we have to know is it needs a very committed efforts from the public as well as the government. According to the studies, to detect one prostate cancer, we have to test 26 men. So
26?
it involves a lot of financial implication also. So we have to be cognizant of that fact. But what we have to know is, when we are screening 26 people, at least one person will be detected at an early stage, and it will be very important for him and to the family.
Right, exactly. As we've been, championing the idea of early detection, folks. Just imagine, 26 just to possibly, not guaranteed, possibly find one in an early stage. There may be more that has been, so you really need to take into idea of how small our community is.
Yeah.
I mean, when you think of that, we're what is it, under 80,000 now. So when you take that into consideration, we have a really great system here for detection and understanding to support the men and women here who have fallen victim to cancer in any capacity, in any stage. I think back in the days of, tests went off for weeks on end before you could get back results. So we're talking, I remember, from the 70s and 80s, when information wasn't so readily informed here. I remember someone saying at that time, West Indian, we never called it cancer. It was the big C, because people were literally afraid to say the word cancer.
Exactly,
like it would manifest itself on, so they call out all these names. But now we can have honest and truthful conversations about it, and I think that is a betterment to the medical system and also the understanding here.
Yeah.
Let's shift gears a little bit for individuals who might be listening, wondering about their own risk. What advice could you tell them about, monitoring and the PSA level and staying informed about prostate health, doctor?
I have seen many Caribbean countries, and also I know the system in many other countries out of the Caribbean. Of all these countries, probably we have the best system at present. A lot of encouragement for screening, as well as easy availability of the test. And also HSA has been recently JCI accredited. So when we have to take care of men's health is not an issue right now. So to get yourself tested, at least at the age of 50 years, by going through a simple test like PSA, which will be done within few hours, and that by that test you will know that you do have any, is it normal or is abnormal, will you have the based upon the cancer risk, do you have to go for this testing again or not. So this is very simple, and the simple advice is to come forward and get yourself tested.
Exactly.
So HSA, we have good facilities.
When we talk about that, doc, do they need to fast before they take? Is this blood taking? If I wanted to set up an appointment to come in to get my PSA testing, walk me through what the procedure would be for that.
So just get yourself tested at our GP, general practitioner, and get this test ordered. Particularly for PSA, you don't have to get any, there's no restriction. Okay. Like fasting or other limitations. So PSA is a simple blood test. Only blood will be very scanty blood will be, very less blood will be taken, and PSA will be detected.
Okay, so it's not a long drawn process. And in the old days, I remember people dreading to go get a prostate test. They literally had to, as they said, muster up the courage to do that. They used to talk about that. So it's very simple, a simple drawing of blood. Then.
So along with PSA, when they draw blood, other tests also can be done.
Okay, so it's kind of a one-stop shop to kind of check everything to get a great baseline on health based off of that. They check the white counts, the red counts, things of that nature.
Yeah.
Excellent. Okay, folks, we're going to take another quick break and come right back as we cross the 30 marker and getting closer to the top of the hour. You're listening to Healthcare Today with the HSA. I'm your host, Chuck Taylor. Each and every Friday and Saturday, we get together at 1 p.m. and we do this. We talk about your health and all the things related to it. Compliments of our friends over there at the HSA. We're going to take 2 minutes and come right back.
Health Services Authority is now offering online payment options for patients. Patients of HSA can now pay their bills, including deposits, towards scheduled services online at payments.hsa.ky. The secure, new online payment system accepts debit or credit cards and is in addition to the available payment options of cash, check, and online bank transfer. For quick, easy, and secure payment directly from your phone or computer, visit HSA's new online payment system at payments.hsa.ky.
When you have a sports or fitness-related injury, trust the expertise of the HSA Sports and Exercise Medicine Clinic to get you back in the game. Our internationally trained and certified physicians specialize in sports traumatology, sports medicine, pain management, and orthopedic surgery. For treatment of common injuries such as tendonitis, arthritis, tennis elbow, rotator cuff, or knee tears, schedule a consultation with the Sports and Exercise Medicine Clinic at Smith Road Medical Center by calling 949-8600 or visit hsa.ky for more information.
The Health Services Authority's new pharmacy is now open at the Smith Road Medical Center. The new location features a large, comfortable waiting area and ticketing system to improve the patient experience. All uncollected prescriptions and refill requests previously submitted will now be available for collection at the Smith Road Pharmacy. Request your refills online at hsa.ky via WhatsApp 925-6534 or call 244-2715. For more information about our pharmacy hours, visit hsa.ky.
The Cayman Islands Health Services Authority's general practice and public health clinics have relocated to Smith Road Medical Center. At the new location, you'll receive top quality care in a comfortable, modern space, enhancing your patient experience. Do you have flu-like symptoms or other non-emergent illnesses or injury? HSA's new urgent care walk-in clinic is now open at the main hospital campus. The new general practice location is for appointments only. For more information, call 949-8600 or visit hsa.ky.
HSA's cardiology clinic is now located at Smith Road Medical Center. Our cardiology team provides expert care and treatment for heart conditions such as coronary artery disease, heart failure, arrhythmias, hypertension, congenital heart diseases, among others. The new location offers state-of-the-art cardiac diagnostic testing, including echocardiograms, ECGs, and stress tests. To contact, call 949-8600. At HSA, your heart matters to us.
Now back to Healthcare Today with HSA and our host, Chuck Taylor.
Welcome back, folks. Thank you so much for tuning in. This is Healthcare Today with the HSA. If you're just joining us, we are talking about prostate cancer and also the Cancer Registrar. We have with us Amanda Nicholson and Dr. Jyoti. He is here with us. He is a pathologist over at HSA. And well, let me just switch gears and ask Miss Amanda this. Talk to me a little bit about the health registry, how someone can get involved and what you do.
Okay. Well, anyone who is a cancer survivor can register. And by cancer survivor, I don't mean that they're fully recovered. I mean anyone who is diagnosed with cancer and is still alive can participate in the registry. And it's confidential. We ask questions like their date of birth, which district they live in, what were they diagnosed with? Did they get their first treatment on island? What was their first treatment? How were they diagnosed? Was it biopsy, some other way? But all of it is just a one-page document, so it's very short and to the point. And as I mentioned earlier, we don't even put names in the registry.
Very, very, very simple, to the point in understanding. And you said that you just collect as general information as that, but you put it into...
Yes. The information we collect is based on standards set forth by the World Health Organization. And once we have the information, we put it into what's called a CanReg 5 database. CanReg was also designed by the World Health Organization specifically for storing cancer surveillance data. It's safe, it's secure. You need like 20 different passwords to get in there. Okay. Yeah, fast, easy, and secure.
Excellent. And let me ask you this: the information there, does it help with public policy? Does it help with research? Does it help move forward the idea of possibly, and I hate to say it like that, but finding a cure or finding directions towards finding the right idea for it? I
think cancer registries and health registries in general absolutely do have the potential to guide public policy. As I mentioned, ours is voluntary, so we're not capturing every case, but it definitely can help to influence decision-making when it comes to policies regarding healthcare. Or even, I was contacted once because the hospital that was being built at the time wanted to know, how many people are getting cancer, because how many oncologists do we need? How much medical treatment facilities do we need? So it guides public policy. It also, I think, serves as a way to inform the community, you got to get your breast exams. You got to get your prostate exams. So, yeah.
It's a good reminder that, we need to be vigilant in taking care and moving forward in the right direction.
Yes, absolutely.
Exactly. And Dr. Jyoti, based on your vast published research knowledge, talk to me a little bit about data that has been collected worldwide and also locally, how it relates to policy in prostate cancer.
Citing the complex situation of PSA and prostate, we have been associated with a research foundation called AC3, African Caribbean Cancer Consortium. So the first article was in collaboration with them, that linking PSA with the prostate cancer. And recently, AC3 had their conference at Kenya. So there, in that conference, we collaborated with them and published impact of social awareness campaign on prostate cancer. And still there are more robust research activities are going on, especially since cancer is ever evolving area. So we want to test some molecular markers in the future on tissue that is frozen from the patients who already have prostate cancer now. So there is a different project going on. So there are a lot of projects that are going on. Till now, whatever the research we have done, useful data has come out. So linking PSA to prostate cancer, as well as impact of social awareness and how it has helped prostate cancer screening in Cayman Islands.
So it's really information to help probably guide and target awareness for the future based on the information that you're telling and talking to me about, because we have to kind of, I would say, get a map to lead us forward, because realistically this is uncharted territories. I think this is the most I've heard and talked about cancer ever, and I think that's a great thing. But now, how do we move forward with that?
Since Cayman Islands is a small territory, we have our own challenges, and also we have advantages because we have a mixed population here, and also government is of great support here. So, and also, as I told, there is a lot of financial implication, but people are educated, they're coming forward. So by using all these tools that are already been in our hand, we can definitely make a big change. So ultimately, our aim is to reduce the suffering or the morbidity that is resulting due to prostate cancer. So our aim is to reach there.
Okay, excellent. Well, folks, we're going to take our final break and come right back. I'll ask my guests to give me their final thoughts as we get set to wrap up here. You're listening to Healthcare Today with the HSA. I'm your host, Chuck Taylor. We're going to be back in 2 minutes.
Health Services Authority is now offering online payment options for patients. Patients of HSA can now pay their bills, including deposits, towards scheduled services online at payments.hsa.ky. The secure, new online payment system accepts debit or credit cards and is in addition to the available payment options of cash, check, and online bank transfer. For quick, easy, and secure payment directly from your phone or computer, visit HSA's new online payment system at payments.hsa.ky.
When you have a sports or fitness-related injury, trust the expertise of the HSA Sports and Exercise Medicine Clinic to get you back in the game. Our internationally trained and certified physicians specialize in sports traumatology, sports medicine, pain management, and orthopedic surgery. For treatment of common injuries such as tendonitis, arthritis, tennis elbow, rotator cuff, or knee tears, schedule a consultation with the Sports and Exercise Medicine Clinic at Smith Road Medical Center by calling 949-8600 or visit hsa.ky for more information.
The Health Services Authority's new pharmacy is now open at the Smith Road Medical Center. The new location features a large, comfortable waiting area and ticketing system to improve the patient experience. All uncollected prescriptions and refill requests previously submitted will now be available for collection at the Smith Road Pharmacy. Request your refills online at hsa.ky via WhatsApp 925-6534 or call 244-2715. For more information about our pharmacy hours, visit hsa.ky.
The Cayman Islands Health Services Authority's general practice and public health clinics have relocated to Smith Road Medical Center. At the new location, you'll receive top quality care in a comfortable, modern space, enhancing your patient experience. Do you have flu-like symptoms or other non-emergent illnesses or injury? HSA's new urgent care walk-in clinic is now open at the main hospital campus. The new general practice location is for appointments only. For more information, call 949-8600 or visit hsa.ky.
HSA's cardiology clinic is now located at Smith Road Medical Center. Our cardiology team provides expert care and treatment for heart conditions such as coronary artery disease, heart failure, arrhythmias, hypertension, congenital heart diseases, among others. The new location offers state-of-the-art cardiac diagnostic testing, including echocardiograms, ECGs, and stress tests. To contact, call 949-8600. At HSA, your heart matters to us.
Now back to Healthcare Today with HSA and our host, Chuck Taylor.
And we are back, folks. Thank you so much for tuning in. This is Healthcare Today with the HSA. Getting set to kind of start wrapping up. We're talking about the idea, and I want to call it the age of prostate cancer, because right now I think more than ever we have not discussed prostate cancer. You know, it's been breast cancer and things of that nature. And even we've started discussing colon cancer. But now I think prostate cancer has become very pronounced in our thought pattern due to, you know, men's health issues being arising. And I think out of all the times, we probably have more elderly men now than ever. So that indicates that we need to have more conversations about that. With us today, we have from the Cancer Registry, Amanda Nicholson, and also Pathologist Dr. Jyoti. I'll give you the floor, Miss Amanda. Go ahead and let us know our final few words and wrap up.
Sure. Well, any cancer survivors who are listening and haven't registered, I would encourage them to do so. Or, like I said, just give me a call and we can have a conversation about what that involves and what it means. All of my contact information can be found on the HSA's website. The phone number for the registry is 244-2560. And again, it's a very easy process, and I'm more than happy to walk people through it.
Okay, excellent. And Dr. Jyoti?
Today we are just talking about prostate cancer. Again, I want to re-emphasize that prostate cancer is not like other cancers. So prostate cancer has, at the one end, we have a very indolent, very resting prostate cancer, and other end we have aggressive prostate cancer, which has gone to rest of the organs, other organs. So our aim is to detect the cases which are early and not to over-treat those cancers also. So advice is to get yourself tested for PSA levels and make sure that there is no prostate cancer. Even if one has prostate cancer, don't worry, it is at an early stage. We have a modern facilities here in the Cayman Islands. At the HSA also, we have good urologists as well as oncologists, and surgery is available as well as chemotherapy is available. So there are a lot of good things which are coming out of the research, as well as on the island we have very great facilities. So make use of these facilities.
Excellent. Once again, folks, thank you so much for spending your time with us and talking to us, giving awareness to our listeners. Thank you so much. And I will just say finally, if you have been diagnosed with any sort of cancer, doesn't matter, cancer, the most important thing I will tell you is seek treatment early. That is, some people, we fall into this, I don't want to believe it, I don't want to deal with it. You got to stay on point with it and get it taken care of, because this is life that we're talking about. Mm-hmm. And so I'd like to leave on that note. Thank you once again so much.
Thank you.
Thank you.
Excellent. You're listening to Healthcare Today with the HSA. Tune in. We will be right back.
Health Services Authority is now offering online payment options for patients. Patients of HSA can now pay their bills, including deposits, towards scheduled services online at payments.hsa.ky. The secure, new online payment system accepts debit or credit cards and is in addition to the available payment options of cash, check, and online bank transfer. For quick, easy, and secure payment directly from your phone or computer, visit HSA's new online payment system at payments.hsa.ky.
When you have a sports or fitness-related injury, trust the expertise of the HSA Sports and Exercise Medicine Clinic to get you back in the game. Our internationally trained and certified physicians specialize in sports traumatology, sports medicine, pain management, and orthopedic surgery. For treatment of common injuries such as tendonitis, arthritis, tennis elbow, rotator cuff, or knee tears, schedule a consultation with the Sports and Exercise Medicine Clinic at Smith Road Medical Center by calling 949-8600 or visit hsa.ky for more information.
The Health Services Authority's new pharmacy is now open at the Smith Road Medical Center. The new location features a large, comfortable waiting area and ticketing system to improve the patient experience. All uncollected prescriptions and refill requests previously submitted will now be available for collection at the Smith Road Pharmacy. Request your refills online at hsa.ky via WhatsApp 925-6534 or call 244-2715. For more information about our pharmacy hours, visit hsa.ky.
The Cayman Islands Health Services Authority's general practice and public health clinics have relocated to Smith Road Medical Center. At the new location, you'll receive top quality care in a comfortable, modern space, enhancing your patient experience. Do you have flu-like symptoms or other non-emergent illnesses or injury? HSA's new urgent care walk-in clinic is now open at the main hospital campus. The new general practice location is for appointments only. For more information, call 949-8600 or visit hsa.ky.
HSA's cardiology clinic is now located at Smith Road Medical Center. Our cardiology team provides expert care and treatment for heart conditions such as coronary artery disease, heart failure, arrhythmias, hypertension, congenital heart diseases, among others. The new location offers state-of-the-art cardiac diagnostic testing, including echocardiograms, ECGs, and stress tests. To contact, call 949-8600. At HSA, your heart matters to us.